Chronic HP, chronic hypersensitivity pneumonitis, is a long-term inflammation of the lungs caused by an immune system reaction to repeated inhalation of inhaled environmental antigens, often organic dusts or particles. It's a condition in which the lungs become inflamed due to an allergic reaction to particles, which can cause scarring over time, potentially leading to pulmonary fibrosis, lung scarring. Diagnostic tools. History and clinical symptoms. Patients. History of exposure to potential triggers, such as bird droppings, feathers, mold, etc. Symptoms include chronic cough, shortness of breath, fatigue, and chest tightness. Imaging tests. High-resolution CT, HRCT. This is the gold standard imaging test. It can show characteristic patterns like ground glass opacities, air trapping, and fibrosis in the lungs. Chest X-ray can also be used but is less sensitive than HRCT for detecting early changes. Pulmonary function tests, PFTs. These tests assess lung function by measuring lung volume and airflow. In chronic HP, you might see a restrictive pattern, reduced lung volume, and reduced diffusion capacity for carbon monoxide, DLCO. Serology, blood tests. Tests for specific antibodies, such as anti-bird antigen antibodies or serum markers, might be done, but they are not always specific or sensitive. Bronchoscopy and lung biopsy. In some cases, a lung biopsy or bronchoalveolar lavage, BAL, may be necessary to definitively diagnose HP and rule out other lung diseases. Biopsy can show granulomas and inflammation typical of hypersensitivity pneumonitis. Treatment, avoidance of the antigen. The cornerstone of treatment is removal or avoidance of the triggering agent, e.g., avoiding exposure to birds or mold. Corticosteroids. In acute exacerbations, corticosteroids, like prednisone, can be prescribed to reduce inflammation. Chronic use of steroids may be needed if symptoms persist despite antigen avoidance, immunosuppressive drugs. If symptoms are severe or don't respond to steroids, other immunosuppressive medications, like azathioprine, mycophenolate mofetil, or methotrexate, may be used. Oxygen therapy. For patients with advanced disease and significant lung function impairment, supplemental oxygen may be necessary. Pulmonary rehabilitation. In cases with significant fibrosis or difficulty breathing, pulmonary rehab programs can help improve quality of life by strengthening the muscles used for breathing and improving exercise tolerance. Association with bird exposure. Bird fancier's lung, avian HP, is a specific form of chronic hypersensitivity. Pneumonitis caused by exposure to bird droppings, feathers, or dust. This is a well-known cause of HP, particularly in individuals who are involved in bird breeding or who frequently interact with pet birds. The primary triggers are avian proteins that are present in the feathers, droppings, and dander of birds. When inhaled over time, these proteins can provoke an immune response in the lungs, leading to inflammation and, in some cases, fibrosis.